continuing with alcohol withdrawal syndrome, here are the clinical manifestations that we talked about just a little bit. Also fatigue, nausea, vomiting, insomnia. Like I said in the last lecture, that sometimes symptoms can appear to be stroke-like symptoms, and if that's the case, then you will need to order, start stroke protocol, but we'll get into that in semester 3. Delirium tremens, it's the most severe form of alcohol withdrawal. It's altered mental status with tremors. It is a medical emergency. Also with tremors, you see diaphoresis, tachycardia, hypertension, severe anxiety, severe agitation, disorientation, seizures. So if you have a test question about delirium tremens, your priority response is going to be initiate seizure precautions, put on the padded side rails, make sure the head of the bed is up 30 degrees, make sure suction is hooked up and working. This is a safety issue. Stages of withdrawal, there's stages 1 through 3. I'll kind of let you look at that on your own. Treatment is individualized, and because their mag and their potassium is so low, they'll need electrolyte replacement. They'll need nutritional support because people that are chronic alcoholics don't eat, so they will definitely need things like multivitamins, TPN in really severe cases, maybe thiamine injections, magnesium, obviously with electrolyte replacement, glucose. Benzos are the drug of choice. Be sure these patients to maintain IV access because you will be giving medications like, lorazepam, diazepam, anything that ends in pam, that's a benzodiazepine. Remember, the client has a tolerance to alcohol, so it's going to take more benzos to bring them down. Saw that a lot in cath lab when I'd go to medicate patients. Usually, benzos, depending on the benzo, they're short. They act fast, but they wear off relatively quickly. So know that you'll need to go in and reassess your patient every couple of hours. Nursing interventions, like I talked a little bit earlier, fall and seizure precautions if indicated. Elevate to the head of the bed to reduce aspiration. Be sure to provide non-judgmental, supportive, empathetic care for these patients. Compassion fatigue is definitely a real thing, and you will experience it in nursing at some point in time in your career. Just remember, supportive, empathetic care. Make sure airways patent suction, like I said earlier, it's hooked up, it's working, it's ready to go. Monitor vital signs, monitor for respiratory distress. Assess your patient for skin abnormalities like jaundice, pressure ulcers because of the risk for impaired skin integrity, rashes. These patients tend to have low platelet counts, so be sure to be assessing their trunk for the pinpoint petechiae. Be sure to use your CWA regularly. I'll let you guys read through this next part kind of on your own. Administer IV fluids as prescribed. Assess dental hygiene because dental hygiene could contribute to weight loss, and then obviously, of course, cardiac monitoring because you want to monitor anything that could be life-threatening. Discharge planning is important for these patients because they may need to go to a facility. They could need to go to a halfway house or rehabilitation. They might need to do intensive outpatient therapy. It just depends on the patient. Ask the patient to sign a consent form and that they should stay away from, alcohol, including cough syrups, aftershave, cologne, Purell. I've known patients to drink that because there's alcohol in it. And we'll finish right there with alcohol.